Hello, my name is Ashley Griffin. I'm a nurse practitioner student at Auburn University, and today in this video I will be demonstrating how to perform a head-to-toe assessment. Normally in the clinical setting, the patient would be dressed in a gown to give you easy access to visualize the different areas that you're assessing and to put your stethoscope directly onto the skin, but for the purpose of this video, my patient is going to remain clothed. And also for the time constraint of the video, even though we might be assessing things bilaterally in real life clinic, here I may only do one side, and I will verbalize when I'm doing that as well. Now I've already washed my hands. We have already obtained a set of vital signs, height and weight for the patient, and that was all within normal limits. Now first I'm just going to take a general survey of the patient. I'm going to take note of the mood, posture, motor movement, note if there's any body odor or any breath that I can smell. Just take a general survey of the patient. Make sure he is dressed appropriately for the weather and for his age. So to begin the head-to-toe assessment, we start by inspecting the scalp and the head. And throughout this whole assessment, you are continuously looking at the skin for any rashes, bruising, any abnormalities, any skin breakdown, anything impairing the skin. I'm going to palpate the scalp, the head. I'm checking the texture of the hair distribution, feeling for any nodules or masses in the head or any tender areas. Any tenderness?
No.
Okay. Next, we'll move down to the sinuses and palpate the sinuses. You've got your frontal sinuses and your maxillary sinuses. Any tenderness there?
No.
Okay, all right. And during the assessment, even though we're going in an organized fashion, I am going to be checking some cranial nerves along the way. So first of all, for cranial nerve number 5, well, before I do that, I want to check your TMJ, just assessing the joint. Then I'm going to have you clench your jaws, okay? And that assesses cranial nerve number 5. Now to check cranial nerve number 7, you want to look at the movement of the face. So you can have your patient raise their eyebrows, all right? Frown, smile with your teeth. Okay, and puff your cheeks out. Okay, all right, so that's cranial nerve number 7. Now we'll move to the eyes. You want to inspect the eyebrows, the eyelashes. You want to look at the conjunctiva, make sure it's pink and moist. Make sure there's no discharge coming from the eyes. Now there are several cranial nerves that you can check with the eyes. For cranial nerve number 2, you can assess visual acuity with the Snellen chart. I do not have one, but you could use the poster at 20 feet away or the smaller chart at 14 inches from the patient. The patient would read the smallest line that they could, and their visual acuity would be the number to the side of that line. I just don't have a Snellen chart. Also, we can do the confrontation test also to check the cranial nerve. So I'm going to get you to cover this eye, and I'm going to wiggle my fingers out, and I want you to tell me how many fingers you see as soon as you see them. Just look at me.
2, 1, 3, 4.
Okay, and we would do the same thing on the other side as well. All right, next we'll do the cover-uncover test. And this helps to check for cranial nerves 3, 4, and 6. So you stand in front of the patient, cover your right eye, take your hand down, cover your left eye, take your hand down, and you're looking for any deviations there in the eyes, which I did not see. Also to check cranial nerves 3, 4, and 6, I want you to follow my pen with your eyes only, don't move your head. Okay, all right, and that checks cranial nerves 3, 4, and 6 for us. Now for cranial nerve 3, we can also assess how your pupils react to light. and they should constrict on both sides, which they did. Now we are going to move to your ears. For your ears, we can check cranial nerve number 8 with the whisper test, the Weber test, and the Rhine test. So I want you to repeat out loud what I'm whispering. ABC.
ABC. 1, 2, 3.
Okay. Now with the Weber test, I'm going to strike this on my hand and place it on top of your head. This is to check for lateralization. I want you to tell me if you hear it the same in both ears or if it favors one side.
Both.
Okay. For the Rhine test, I'm going to strike it again, and I'm going to place this on the bone behind your ear. I want you to tell me when you stop hearing it. And then I'm going to move it to beside your ear, and I want you to tell me again when you stop hearing it.
Now. Now.
Okay. That's checking bone conduction and air conduction, and his test was normal. The air conduction should be longer than the bone conduction. All right. Next we will inspect the ears. You would want to do this on both sides. Look at the outside of the ear, feel for any tenderness, check the skin for any rashes, any discharge. Then you'll want to look in the ear, at the outside of the ear. Then you'll want to look in the ear canal. You're wanting to make note of any earwax, any redness or irritation, inflammation in the ear canal. Then you'll look back to the tympanic membrane. You should see the pearly gray and the cone of light, which is present. And you would do that on both sides. We also need to examine the eyes. You first want to check for the red reflex, and then you can look in and inspect the lens, check the optic disc, and check the blood vessels. Starting with my dial on 0. I'm going to check this side. Okay. All right. The optic disc is a yellowish orangish color, and all the blood vessels are intact and look okay. Now we've done the eyes, the ears. We're going to move to the nose. We're going to inspect the outside and the inside of the nose. You can palpate for any deviations there. Then you want to inspect the nose. You're looking for any excessive discharge. You do want the membranes to be moist. Looking for any polyps, any septal deviation. And then you move down to the mouth. You want to inspect the lips. Make sure there's not any excessive, drying around the lips. Then you want to look in the mouth. When you're looking in the mouth, you want to look at the roof of the mouth, under the tongue. You want to look inside the cheeks. You want to look at the gum lines. Teeth are intact. And you're wanting to make sure that everything is pink and moist. There are also some cranial nerves here that we can check. I'm going to check his uvula, which should be midline, for motion. All right. Say ah. All right. And that is cranial nerve number 9. Now, if I had a tongue depressor, I could check his gag reflex, which is cranial nerve number 10. I don't have a tongue depressor. We can also check cranial nerve number 12. If you stick out your tongue and lift it up and down and side to side, that tongue movement does help us check cranial nerve number 12. Okay, so we've completed everything with your head. We're going to move down to your neck. And of course, we want to inspect the skin on the neck and then palpate for any tenderness, any masses. We can do some range of motion with your neck if you go side to side, front to back, and rotate side to side. Okay. Now shrug your shoulders. Okay. And then turn against my resistance. Other way. Okay. All right. Good job. That checks cranial nerve number 11. Okay. Now we can go ahead and assess the lymph nodes. You want to do these at the same time and compare sides, palpating with your finger pads. Pre-auricular, post-auricular, occipital, tonsillar, submandibular, submental, superficial cervical, posterior cervical, deep cervical chain, supraclavicular. You've also got the lymph node here, the epiclotier or epitrochlear lymph node here, and then the inguinal lymph node is here. We'll check those in a little while. So now I'm going to assess your trachea. It should be midline. And to check your thyroid, you come behind the patient. You either have them sip on some water or just swallow. Okay, and you should be able to feel the thyroid there. Now we'll go ahead and take care of the posterior thorax. Again, the patient would be in a gown, so I would have direct visualization of his entire back. I would be inspecting the skin for any bruises, any impairments anywhere in the skin. And after you inspect, then you can palpate. You can check for any tenderness or any masses anywhere. Any tenderness?
No.
Okay. And then you want to percuss. You want to move top to bottom from side to side so you can compare side to side. After you percuss the lungs, then you can check for CVA tenderness. And you check that by percussing under the 12th rib. Any kidney pain there?
No.
Okay. All right. Then you're ready to also take the lungs. Again, normally you would have your stethoscope in direct contact with the patient's skin. And you want to work side to side from top to bottom. You want to listen with the diaphragm and the bell. And you want to listen at each site for a complete breath. Just breathe in and out for me. Okay, that completes the posterior thorax. Now we'll go to the anterior. Oh no, we've got to check tactile fremitus and symmetry. So every time I move my hands down, I want you to say 99.
99, 99, 99, 99.
Okay, all right, that's tactile fremitus. And then to check symmetry, you want to position your hands around the 10th rib and have the patient take a deep breath in and out. Okay, and with that, you're looking for symmetry with the movement of your hands as the patient breathes in and out. Now we're ready to go to the anterior chest. Again, we would have direct visualization of the chest, making note of anything that's going on with the skin, any rashes, any bruising. You can check hair distribution on the chest. Then we can palpate the chest. You can also, palpate. You might notice that there are some cardiac pulsations that you can make note of. And we can check tactile fremitus on the front as well. So we're going to repeat the 99.
99, 99, 99.
Okay, all right. Now we'll also take the lungs. And again, you want to go in the same systematic approach, listening with the diaphragm and the bell. Okay, and you're listening to make sure that there aren't any abnormal breath sounds. You want the breaths to be clear and equal, not diminished anywhere, no wheezes, crackles, or ronchi. Now we're done with the thorax, and we are going to go to the cardiovascular system and the peripheral vascular system. So we'll start by palpating the temporal artery. And then you want to move to the carotid. Now you would assess both sides of the carotid, but not at the same time. Okay, and then you want to listen with your diaphragm and your bell. Okay, good job. Now you want to palpate for PMI. Okay, and you want to listen to the heart sounds. Again, you want to listen with your diaphragm and your bell. Apical. Pulmonic. Herb's point. Mitral. No, excuse me, tricuspid. Mitral. Okay, and you would repeat the same with the bell of your stethoscope. Now we'll assess distal pulses. That's your brachial pulse, your radial pulse. It's a good time to go ahead and assess capillary refill and all the fingernails. You want it to be less than 2 seconds. Checking the skin, hair distribution. The skin is nice and warm. We would do the same thing on the other side. We'll check your femoral pulse when you're laying down, and your popliteal, the rest of your pulses when you're laying down. If you want to go ahead and lay back, and we can also be checking on the right side for any external jugular vein. If we did need to measure that, we would start at 30 degrees and have a vertical and a horizontal measurement from the highest point of pulsation. Now, with the patient laying back, you want to listen to the heart sounds again, just like before with the diaphragm and the bell. And again, normally you would be in direct contact with the skin. Okay, and then we would move down and check the femoral artery. You can go ahead and check the inguinal lymph node here as well. Popliteal pulse, dorsalis pedis pulse, and the posterior tibial pulse. When you're grading pulses, a normal pulse is brisk, and that is labeled as 2+. You also want to check capillary refill in the toes. Again, they should be less than 2 seconds, just like with the fingers. I'm going to go ahead and do a little bit of the neuro test with the Babinski. And in an adult, the toes should not fan out. That would be a positive sign. which would not be a normal finding in an adult, but it's normal in babies. Okay, now we're going to move on to your abdomen. Again, you know, I would normally have direct visualization of the abdomen. We can go ahead and inspect the abdomen, but you always want to auscultate before you start to touch the abdomen. So you want to listen in all 4 quadrants. Bowel sounds are active. And percuss. All right, and on the liver is in the right upper quadrant, and you can percuss up to that to get a measurement of the liver. And you want to make sure you're on the mid-clavicular line. Your spleen is going to be in your left upper quadrant. You can lightly palpate the abdomen for any masses or any tenderness. And then you can use deep palpation to palpate the liver, the spleen, the left kidney, and the right kidney as well. Okay, I am going to let you sit up. Okay. We've done your heart check, we've done your peripheral vascular system, your abdomen. Now we're going to do your musculoskeletal check. We've already done range of motion with your neck. It's important to palpate all the joints to make sure there's not any crepitus. You want to check range of motion. Can I get you to just lift your arms in all directions? Okay, and cross your arms in front and then back. Check your elbows and your wrist, fingers, good movement in your fingers. Any soreness anywhere or anything? Okay. Okay, all right. I'm sorry, I'm going to get you to lay that down one more time. I want to check your hip range of motion. Can I get you to bring this knee in and just rotate it out? Okay, all right. You can put it back down and sit back up for me. Okay, and so go ahead and just bend your knee again and then move your ankle around. Wiggle your toes. And again, you would be wanting to do this bilaterally on both sides. You also want to check muscle strength. 5 out of 5 is normal. That's strong muscle strength. You can check bilateral grip. His grip is strong. When you're looking at the extremities, you also, just want to keep note of the hair distribution, any lesions on the skin, any bruises. Make sure the skin is nice and warm. Okay, now a few more neuro checks. I know that I missed cranial nerve number 1. I want you to close your eyes, and I'm going to put something in front of your nose, and I want you to smell it, but I want you to cover one side. This is going to check patency and your sense of smell. All right?
Alcohol.
Okay, all right. And we would do that on both sides, and again, that checks patency and cranial nerve number 1. Next, we're going to continue with the neuro assessment. Now, during this exam, typically you're conversing with the patient, so you're able to hear their voice and their articulation. And from that, you can check cranial nerves 5, 7, 10, and 12. Then you want to check reflexes. All right, hang your arm out to the side. Okay. Then if you can sit back so your feet are hanging. Pop the tilt. Okay. And then your Achilles. Okay. Now, just to check your motor function, can I get you to just slap your hand? Yeah. Okay. all right, good deal. To check sensory, I've got a soft object and I've got a sharp object. I want you to close your eyes. I want you to tell me where the object is and which object it is.
Soft left side of the face. Sharp right leg.
Okay, all right. And you could do this, you know, several different areas of the body just so they can tell the difference in the soft and sharp and the location of the sensation. All right, he is alert and oriented to person, place, time, and situation. He is able to recall short-term and long-term memory. His mental status is good. His mood is good. He's a very pleasant patient. Next to check stereogenesis, I'm going to put an object in the patient's hand and have him close his eyes and see if he can tell me what the object is without looking at it. All right, hold your hand out. And can you tell me what that object is?
Paperclip.
All right, very good. And again, that checks stereogenesis. Now I'm going to have you point to my finger, like touch my finger, and then go to your nose again and again. Okay, that's checking his coordination. We could do that on the other side as well. Let me make sure there's nothing else you need to do before I have you stand up. Okay, go ahead and stand up for me. We're going to do the Romberg test to check your balance and your coordination. So just come up on one foot and hold your arms out. Okay, now close your eyes. Okay, all right, very good. And now come over here with me and just walk across the room with your normal gait. Okay, now come back on your tiptoes. Okay. All right, now turn around, hop up and down. Okay, now walk heel to toe, just across. Okay, you can have a seat. And that concludes our assessment. Thank you.